the Vanderbilt community, I hope you're doing well as we continue to support each other and learn together during these unusual times. Today I'm going to be speaking with my colleague, Dr. David Aronoff, Professor of Medicine, Pathology, Microbiology, and Immunology, and the Director of the Division of Infectious Diseases at VUMC. Now, over the past several weeks, Dr. Aronoff has been talking with a number of local and national media outlets, doing his part to keep our society informed and protected. Many of you also saw him on Vanderbilt's recent Ask an Expert video about how long the coronavirus can live on inanimate surfaces. Thank you, Dr. Aronoff, for all that you've done and for being here today with us.
What a pleasure. Thank you so much for having me today.
As we're filming this, we're in the middle of Vanderbilt University's 5th week of studying and working remotely. And during this time, I know all of my colleagues, all of our students, faculty, and staff are learning a lot about social distancing, tips for hand washing, all protective measures. Do you think people are getting the message, and what makes you think that they're getting that message?
I do think people are getting the message. Of course, I have to come into the hospital every day to help with the care of our COVID patients. And so I can see that the campus is deserted. People are really taking this very, very seriously. And outside of the campus, it's very clear that within Nashville, within Davidson County, and across the state of Tennessee, there's been a lot of efforts to shelter in place. And I think we're seeing that at the hospital, that the number of patients presenting every day for care is not overwhelming our healthcare system. And I think that that's a direct reflection of the fact that individuals are being responsible and are doing their part to, as we say, stay apart.
Could you also talk about your approach to teaching and whether or not that's changed during this time?
We're doing things just like you and I are doing right now. We're leveraging the power of electrons to communicate with each other. It's important for our students to understand that even though they may be participating in social distancing or sheltering at home, that that's not the same thing as being alone, or not the same thing as being completely cut off or disengaged. So we're really working hard to make sure that the ways that we interact with people are active and open. I send a newsletter to my faculty every single day. We have our faculty meetings online. We're making great use of texting, and the same is true for the way that we engage our students.
So is there any special information that you're prioritizing with your students as you're continuing to educate future physicians and scientists?
I always want to make sure that our students are cognizant of the fact that their world is being turned inside out by an infectious disease, by something that's important for medicine, but also touches on health disparities. And there's lots of lessons that we can learn by looking around us at the impacts of this pandemic.
I really appreciate all that you're doing for our students and for the whole Vanderbilt community. Thank you so much.
It makes me so proud to be a part of this community, in part because I'm getting to see firsthand how everyone's taking their part to care for each other in addition to themselves. So I really want to extend my thanks, because our ability to do that comes from leaders like you, and I really appreciate that.
We're fortunate to have you as a leader here with us. Couldn't do it without you. Thank you so much, Dr. Aronoff.
You're welcome. Thank you so much.
I'm grateful to the many scientists, physicians, and healthcare professionals at Vanderbilt and VUMC and beyond who are furthering critical research, treating patients, and saving lives, as well as the staff members who are working hard to support and protect our campus and those members of our community who are continuing to work hard every day. Together, we're not only persevering, but we're making a difference in our society. Thank you all for doing your part.